So let's have a look at Yuliiana's work. Oh, date of birth. I'll tell you what, I'll put this on track changes so that we can see what's going on. Date of birth. So this again, it looks like a good length and it's well laid out. Names have been spelled correctly. It's a good starting point. So introduction, I'm writing to refer my patient, good. Mr. Nguyen to your care for periodontal treatment. Oh, I just point out here, there's a lot of information between the name and the relative pronoun, and that's a bit dangerous because it's easy to lose the thread of what's going on there. I think you'd be better off just having a full stop and starting again there. I mean, never be afraid to simplify your language. It's the safest option and it's often the clearest option and often the most natural way of speaking as well. So I'm writing to refer my patient, Mr. Nguyen, to your care for periodontal treatment. He would like to save all his present teeth and especially teeth 24 and 27. So we don't need a comma, we've only mentioned 2 teeth, so we'll link them with and 27, which are linked with a bridge. Bridges are countable. Okay. Dear, I can see that the same thing's going to happen as it happened with Jana. It's obviously a really clever trick here. There's no mention of 31, 32, 41, or 42. Anyway, it's a great introduction apart from that. Mr. Nguyen visited my clinic today with a complaint of. It's much better if you just say complaining of. It's much safer as well. I mean, this complaining of is standard medical language, but obviously it's from the verb to complain, and you have to be careful how you use that because if the patient read your letter and misunderstood, they'd think that you were criticizing them and saying that they were always complaining or something. So if I were you, I'd just stick to that. Visited my clinic today, comma, complaining of. Remember that, complaining of. Try to avoid that. In fact, I'm just going to delete, make sure it doesn't confuse anybody. Complaining of pain and swelling in his palatal, where is palatal an adjective and palate is the noun? I'm not 100% sure, but that, because I'm not familiar with dental language, I'm doubting myself, but my language knowledge is telling me that it should be palate there. And palatal is an adjective to describe a noun to do with the palate. In his palate, where the bridge has been fixed. Complaining of pain and swelling in his palate. Hang on, I'm getting confused. Yeah, this is a little bit confusing, the way you've listed the ideas. What is he complaining of? We need nouns here. Pain and swelling in his palate, good. But now it gets confusing because he's complaining of left maxilla or he's complaining of pain and swelling in his left maxilla, which is okay. But now you're adding losing anterior teeth. So I'm a bit confused. I mean, if I were you, I'd go like this. I'd put the left maxilla here because that's a nice simple idea. This is more complicated because you've got this relative clause coming after it where the bridge has been fixed. Yeah. Complaining of pain and swelling in his left maxilla. And his palate. So we're making it very clear by using and that we're introducing a new noun here, palate, where the bridge has been fixed. And another idea now, losing. Yeah, I think because it's like losing, we can't really, it doesn't sound quite right as a noun. So I just add an extra sentence. He is also, I mean, oh yeah, also losing anterior teeth. I mean, maybe, I think you should name them. Yeah, I think you should be more specific. There's nothing wrong with being specific in a medical letter. Most of my students are not specific enough. It's useful. He needs to know exactly what he's doing. So if you tell him what the problem is with which teeth, he's going to be much clearer. And that's your job in the speaking test. Like, what's the problem? Which teeth or which area of the gums or the mouth? And just tell it to your reader. Give them the information they require. Anterior teeth, 31, 32, 41, and 42. There. The examination revealed that tooth 27 is vital. Good. Pus is coming out. Yeah. I mean, leaking might be better. Periodontal pocket is 10 millimeters deep, maybe, just to give that extra definition. Right, let's list this with using the correct pronunciation then. The examination, that's your subject, revealed that verb, object. Tooth 27 is vital. Pus is leaking. Okay, I think that should be our next idea. And I think it's better if you say, because this is the first time we talk about the periodontal pocket, so we need to introduce it. There is a 10 millimeter deep periodontal pocket. We can keep it like that. And now here we could just keep it clean. A radiograph showed no apical pathology. I performed past training, or even better, I drained the pus. That's a sentence I thought I'd never say. I drained the pus. And suspect a periodontal abscess. Brilliant. Great use of suspect. Metronidazole has been prescribed. Mr. Ngoria's periodontal issues started in 2012 with acute periodontitis and anterior laryngitis were loose. Just go through that for you here, right? Adjective, loose. Verb, loosen. That's not really a noun. You could say loosening. That works. Acute periodontitis and anterior laryngitis. I mean, say his. Remember to use possessive pronouns, personal possessive pronouns, because they make your letter sound more personal. His anterior laryngitis were loose, comma, due to poor oral hygiene and calculus. Oh no. Oral hygiene was not performed on a regular basis. And I don't think you need to say that. That's repetition. Because you've already said he had poor oral hygiene. We don't want to keep going on about it. We just say it once. And in 2017, he first presented with deep periodontal pocket in tooth 27. We're not going to call it the tooth. We're going to call it tooth 27 because actually the number 27 defines which tooth it is. We don't need to say the tooth. For example, if you go to a play or cinema, you say you're in seat 26. You wouldn't say you're in the seat 26. Or a hotel, you're in room 11. You wouldn't say the room 11 because the number defines it for you. I would like to inform you that. Okay, I think it's more natural to say, please note that. And remember, in OET, there are no points for using clever language. I mean, that is really, it's harder, it's more advanced. Maybe it's more impressive, but we're going for simple. And actually, this is more natural and more commonly used. So go for please note. Please note that Mr. Tran, hang on. Pretty sure his name's Nguyen there. That's the most common Vietnamese surname. Has positive. Okay, so what we say for that is we say he is hepatitis B positive. That's how we express that. Please, no comma, because that kind of changes the tone of your request. If you say, please perform periodontal treatment, it sounds a bit more like desperate request or more begging or anything. But just please perform just sounds like a everyday, polite, professional request. Please perform further periodontal treatment for Mr. Nguyen, noting that he wants, okay, here's a useful tip, wishes is a little bit more formal and more appropriate in a medical letter. To remain, not remain, he wants to retain. So remain means stay and retain means keep. Remain equals stay, retain equals keep. There we go. Okay, quick marking. Purpose. I mean, you have mentioned it, but I don't think you haven't given enough detail. So I am going to be really mean here and give you a 1. There's a chance you'd get a 2 on test day, but I want you to really remember this and make sure that you identify your requests and make them in sufficient detail, because if you get that wrong, you're very likely to get this wrong and then you fail. And Yuliiana, you've got a really strong chance of passing this exam. I'd hate you to fail because you didn't notice something tiny in the case notes. And this kind of in here, look how tiny it is. Lower anteriors mobile. Just that small thing, it needed including. That's the kind of thing that fails the most able students. So please be careful. Yeah, so I'm just going to make a note here. You should have mentioned the 4 loose teeth in more detail. Content. Unfortunately, it's going to be a 3 or a 4. The previous comment. I mean, you did mention them, but not in enough detail. So you might get a 4. Clarity and conciseness. Yeah. Okay. I think that's a 4 or a 5, but I'm going to give you a piece of advice, which I really hope you follow. And it is keep it simple. Keep it simple. Don't try to include too many clauses in one sentence. Your work's very similar to Jana. You're at a very similar level, and I think I'm right in saying that Jana, did she pass her writing or her speaking? Either way, you both, there's no reason why you and Jana should not pass this exam. Genre and style. Nice. Just notice little things that I've tipped you off on here, like please note and he wishes, all of that kind of thing. That really helps with your style, but it's all very nice. 6 or 7. Organization and layout. So we've got a clear introduction and we've got some information up what happened today, what's going on, current medical concern, what's the problem. Then we've got some background and then a request. which I would say requires more detail, hence the lower marks here. Anyway, the organisation is good. Language is good. There's a couple of dangerous spots where I'm nearly confused, but again, that comes down to this issue here. Keep it simple. 5 there. So exactly the same as Yuliiana. You've got a C plus. Make sure you read the case notes very, very carefully and make your requests in enough detail. That's your golden rule. If you do that, it's a very strong B. Well done.